All right. Again, good morning. It's about 10 o'clock, so I think we'll get started. Thank you all for joining us today on our part one session of our three-part series called Dealing with Dementia. We're excited to have you on today, and hopefully you learn lots of great information. My name is Christine Drasher. I'll be your host today. I am with Emerald Crest Memory Care. I'm the director of marketing there, and Emerald Crest is sponsoring today's session. And just to give you a little information about what Emerald Crest has to offer, we have 4 locations in the metro area. We provide only memory care. Our 4 locations are at Burnsville, Minnetonka, Shakopee, and Victoria. We've been doing memory care for over 20 years. And our setting, as you can see there in the photo, is more of a home setting. It's a 1-level house with 12 units to it. We designed those homes specifically for dementia-related conditions to be an alternative to a nursing home. So each of our campuses do have multiple houses that look like that on the campus. And what we found works really well is if we have different stages of dementia care. So we have some unique programs that are specific to early stage, middle stage, and late stage, and they're all in different houses. So when individuals move into our setting, they are placed according to an assessment in the house that we feel would meet their needs best. Just a few other things just to kind of share with you. You're going to learn a little bit today about our occupational therapy and how that's involved in the placement of our individuals into their homes. So what's really nice with that is we really focus on their ability rather than their disability, and making sure that we're providing activities, providing guidance, providing cares that are meeting those individuals where they're at with their dementia so that they have success. Our environments are nice and small and home-like. Like I said, 12 to 15 residents to a house, and it's very easy to navigate. So the houses allow them to age in place very easily. And then we do have nurses along with our occupational therapists that develop care plans and really focus on that individual's unique needs so that they have success, along with our 24-hour care. There are 4 locations there. Elizabeth Wendell is our admission person. And so if you are interested in learning more and coming out and touring, she can also do a video tour if you'd rather do that. Her phone number is listed right there. So feel free to give her a call and she'd be happy to show you around. Emerald Crest is part of the Cassia community. Cassia is a legacy of Augustana Care and Elam Care. We have lots of different types of senior housing options within Minnesota, but we also reach out to Iowa, North Dakota, Colorado, and Florida as well. If you want to learn more about Cassia, you can go to their website and get all sorts of information about the services that they provide, from independent living all the way to long-term care and short-term rehab, adult day services, assisted living, memory care, all those different types of services. We also have some other services outside of housing, such as hospice, home care, pharmacy, assisted technologies, medical supply, and rehab therapies, also within those serviced areas. So feel free to check out more about Cassia on cassialife.org. All right, so we're going to get started with our presentation today. I just have a couple housekeeping things I want to go over with everyone. Please stay muted, and if you can turn off your video as well, that just makes it a little bit easier for any issues that we might have with people's photos popping up or noise in the background. So if you can turn both those off, we'd appreciate it. If you are a healthcare professional and you will be wanting a CEU hour after this, I will be sharing that information on how you can get that at the end of the presentation. And we'll also open up for questions at the end of the presentation as well. So, but if you do have questions during the presentation, you can also put it in the chat, and I will be monitoring that as Sarah is talking here. So, all right, we're going to get started, and I want to introduce our presenter today. It's Sarah Ziegler from Emerald Crest. Sarah is an occupational therapist at the Emerald Crest of Burnsville location. She has been there for over 13 years. Probably need to update those years there, Sarah. And she has been in that occupational therapy role there, working very closely with the housing director, the nurse, the direct caregivers, and families to identify what challenges or gaps that our resident or their loved one may be experiencing due to their dementia. She works with the team to identify and develop strategies, techniques to fill in those gaps so that we can really maximize that person's abilities and level of function. Sarah focuses on cognitive assessments, behavior management, staff training, and finding opportunities for residents to participate in daily care and meaningful activities that promote that success and self-worth. So I'm going to turn it on over to Sarah and we'll get started here. So thank you, Sarah. It's on. You're up.
All right. Good morning, everybody. Thank you, Christine. Just had to unmute myself. I started talking and I'm still muted. So good morning, everybody. From where I am to where you are, probably at home in your office, miss being together, but I will do my best to present by myself here and give you some more information. My understanding is that most people here are either in a caregiving role, have a loved one with dementia, possibly placed at one of our Emerald Crest locations, or professionals. So I'm hoping I can share more information with each of you, depending on where you're coming from, that'll resonate. So with that, we'll move forward here. Before I start any presentation, this one included, as well as my orientation for new staff, when we're talking about dementia in general, I always ask people, raise your hand if you forget things. Now, that doesn't work real well in this type of forum, but I'm imagining all of you on with us, all 17 of us, have raised our hands right now, because you know what? We all forget. And we all forget, and that's okay. We don't all have dementia. Our forgetfulness is relatively normal. A lot of us will be able to cite things like, gosh, I'm so busy. I'm trying to keep track of this, that, and the other thing. I was in a hurry. I'm tired. And that usually kind of answers that question of why you forget. It's sporadic. It doesn't happen all the time. And you know, the thing for those of us here that forget, that don't have a diagnosis of dementia, our forgetfulness, we can usually retrace our steps or eventually remember that thing that we forgot on our grocery list, or where we parked the car, or which side of the grocery store we went in or out of, and we can retrace our steps. And that's the good news, is that the normal forgetfulness is manageable. However, when somebody has dementia, that forgetfulness that they feel, that they experience, is constant. It happens daily and throughout the day, and affects their overall day-to-day functioning. You know, it's I went to a conference once, and a doctor was speaking about what it might feel like to have dementia. Now, he didn't have dementia, and I guess I really haven't posed this question to somebody with dementia, but what this doctor said it might feel like is, if you are traveling, you're on vacation, you're staying at somebody else's house or in a hotel, and he said, you know, if you wake up in the middle of the night, and for that split second, you have to think about, oh, where am I? I'm not in my home. He said that's likely what somebody that's experiencing this dementia forgetfulness feels. They have that fogginess that they just can't shake. They can't figure it out. They can't retrace their steps. So that's the biggest difference, is that our forgetfulness is normal and sporadic. Theirs is constant. So the good news is here, moving forward, is that dementia is not a normal part of aging. So that's good news. And we'll talk more about what we can do in the later part of the presentation to kind of maintain the healthy brains that we do currently have, and then keep that up. So not a normal part of aging. You hear all the stories of these people that live long, healthy lives into their hundreds. They get highlighted on these morning news programs and things like that. But one of the books that we highlight, a couple people that we highlight when we do this presentation and others, is these two women, the Delaney sisters. They lived into their hundreds. They wrote a book, published it in their 80s, they began writing their story in their 80s, and it was published after they each rolled over 100 years, and it chronicles their life and how they lived a really healthy, wholesome, full life. And just shows that not everybody, as they age, will get dementia. It's not a normal part of aging. It's not just something that happens. There's usually a reason it happens. So these ladies had a lot of nice stories to share in their book. And one of the things that they shared was a list of 3 things that they really think helped them to not develop signs of dementia, or senility, as it was called in their days. They said, number 1, get plenty of exercise, which makes sense. Recommendation is that you get plenty of exercise. What's good for your body is good for your brain. So getting plenty of exercise, taking a tablespoon of castor oil a day. Now, I don't know that sounds real appealing, but they said it worked for them. And the third thing they said was they were never married, and that helped them to kind of maintain a really long, healthy life. And we'll talk later about, sometimes stress contributes to those signs of and symptoms of dementia that we see. So perhaps they were saying that marriage can be stressful, and that spending your life with your sister doing the things you love is a good thing. So anyway, it was just a little quip from that book that they shared, but not a normal part of aging. But we'll move on and we'll talk about what dementia actually is. Little refresher here. So dementia is kind of a general term. We call it an umbrella term that kind of covers a list of different thinking skills that are affected when somebody has dementia. So when somebody is diagnosed with dementia, it's more of a generic, you have issues with your thinking skills or your cognitive skills. So it is more than memory loss. A lot of times when I'll ask a group of people, well, what is dementia? A lot of times the first answer, of course, is memory loss. It's the first thing we think of. It's the first thing we notice in our loved ones or our friends and whatnot, co-workers and things that is likely a sign of dementia, but not always. Oftentimes, signs of dementia happen behind the scenes. It often begins with subtle changes in how that person is kind of managing their independent lifestyle in their house. Are they keeping up with their chores? Are they keeping organized? Are things getting put back where they belong and things like that? Oftentimes also, dementia symptoms are noted at work. The person is not quite as focused on their work tasks. They're not able to learn their new things or work on a project as swiftly maybe as they used to. There could be subtle changes in how a person is managing their finances, not paying their bills on time, in driving and things like that. So a lot of times there's symptoms of dementia that are occurring kind of behind the scenes, because a lot of these things in our households, our jobs, and regarding our finances and driving a vehicle, those are all things we do usually by ourselves or independently sometimes. So others might not notice those changes. So, that first sign might be the memory loss, which is very obvious when somebody's more repeating themselves, sharing the same stories over and over again, asking same questions over and over again. So anyway, just know that dementia signs can show up in other ways than just memory loss. But a lot of times people can cope with those changes with the support, and that's what we'll talk about here, kind of moving forward in the presentation as well, how to cope with that. But it's when people are starting to need further assistance than just those coping strategies, that they're going to need more help, which was that last bullet point in that last slide, of more of a assisted living type facility like we at Emerald Crest provide. The slide we have up now here is, I call it the wheel of cognition. It says there the components of cognition. It is what our thinking skills, what our brain, what all these thinking skills are that our brain does for us. So again, you can see that, memory is just one piece of what our brains manage for us. That 8-pound lump of tissue in our skulls does a lot for us. And so in addition to managing our memories, our brain helps us maintain our orientation. What day is it? What month is it? What season is it? What year is it? Helps us to make wise decisions, set goals for ourselves, stick with those, manage our emotions, our frustration, stay attentive to things, organize our lifestyles. Our language skills are controlled by our brain, our motor skills, the things we do on autopilot, our breathing, our digestion, all of those things are managed by our brain. And when somebody has dementia, all of the things that you see and many more that are on this wheel here, this circle, are affected by dementia. And we will talk going forward here just about what and when some of these changes occur. They certainly all don't happen at once. There's oftentimes a progression of things. So we'll talk a little bit more about that as we move along here. And you're all here. The title of the presentation is What's Normal, What's Not as far as forgetfulness. So perhaps you're noticing changes in yourself or a loved one, or have a loved one that is going through this journey and are familiar with some of this stuff. But signs to look for that you or someone might be showing some symptoms of dementia. These are some signs, the 10 of them that the Alzheimer's Association has put together. So things to look for. Again, these things that you look for are certainly not diagnostic. We'll talk about that here in a minute, that you need to move further beyond these 10 things, but be on the lookout for things that are not normal. These 10 things are not normal. What I talked about at the very beginning of the presentation, normal forgetfulness or changes in your memory. Number one is memory changes that disrupt your daily life. Certainly if you're forgetful to the point where you just can't function, just can't get through your day, if you are seeing that in yourself or a loved one, that is definitely a problem. And so that's number one on their list. Number two, challenges in problem recognition or solving. A lot of times folks that are starting to struggle with this cognitive impairment related to a dementia or Alzheimer's, they're not going to be able to figure out issues that they encounter like they would have in the past. I just think of day-to-day type things that come up, like, oh shoot, my hair dryer won't turn on. What could the problem be? My lights are on or whatnot. Maybe I have to push the surge switch on the outlet. We can problem solve little things like that. Sometimes people, as they're starting to show signs of dementia, aren't able to figure it out. So oftentimes they'll just kind of give up when they encounter a problem. Another thing to look for, number three there, difficulty completing familiar tasks. I think all of us, normally functioning folks that don't have dementia, we have our routines, we have our things that we do day to day, and we don't have to think about them. A lot of us, get out of bed, we take a shower, we get dressed and whatnot. We don't have to think those things through. We just do them. It's automatic. Or I just think of things like, making familiar recipes, preparing dinner for your families. A lot of times, we're not using our recipes. We're just using the fact that we have all this experience because we've made this dish 24 times. And so that's kind of what that's referring to as familiar tasks, things that people do routinely. When those things start becoming harder, that's potentially a sign of some cognitive impairment. Confusion with time or place. Number four, disorientation. If people are unfamiliar with what the date is, what the time of year season, what year it is. Again, I always laugh when I'm teaching this presentation or new employees because we talk about these symptoms and I'll say, forgetting the date is kind of a sign of early stage dementia. And, people laugh and they're like, oh my gosh, I look at my watch, my phone, a calendar all day long because, sometimes I forget, we're so busy, but the idea is that, we know how to figure it out. People that have these signs and symptoms of cognitive impairment, they may not even know that they can use a resource to find the date. So that confusion, not just forgetfulness, that just really not having a clue, not even able to peg like what season it is, that's kind of more of a broad, well, maybe you don't know the date or the month, but what season is it? And a lot of times people with cognitive impairment can't even tell you that. So that's more of that confusion with that time or place and the getting lost piece of it. Number 5 there, another sign to look for, trouble understanding visual images and spatial kind of proportions and things like that. That's another sign that we see earlier in if somebody is showing signs of cognitive impairment is that we see spatial impairments in driving and being able to read things or being able to, write something down in a straight line or copy an image. Those things all change because your vision is highly obviously controlled by your brain. And so a lot of times there's some impairment there that's subtle but noticeable. Number 6 there, if you're noticing that a person is having problems with their words or speaking or writing, a lot of times we all talk a good talk for quite some time, but as somebody is showing some of those earlier signs of cognitive impairment or dementia, you might notice them forgetting words or say, oh gosh, that was on the tip of my tongue, I can't remember. Or using different words in place of a correct word and using that over and over again, so their vocabulary is changing. And a lot of times folks will talk a good talk, like I said, they'll talk a good talk, they'll be able to share stories, but if you spend enough time with that person, you're going to hear the same stories over and over again. Or you might notice that in conversation they're just really not focused and they're talking about one thing and then move to another topic and then go back to that topic they were talking about. So changes in communication can be notable when somebody's developing some cognitive impairment. Number 7, misplacing things and losing that ability to retrace your steps. Like I'd mentioned earlier, that normal forgetfulness is, we can figure it out over time. We'll think through what we were doing when we last had the thing that we misplaced. People that are showing those signs of dementia aren't able to do that, and they just sort of become discouraged and stop looking for that thing that is lost. Number 8, decreased or poor judgment, just making unwise decisions. Early stages of dementia, people's decision-making skills and their ability to filter things changes quite a bit. So just maybe making poor money decisions as far as, sticking to that budget and things like that. So poor judgments, poor decisions. Number 9, withdrawal from work or social activities. A lot of times when people are showing signs of cognitive impairment and they feel it, they notice it in themselves, they're going to kind of take a step back from being around others because they don't want other people to see those things that they're struggling with. And unfortunately, that's one of the worst things you can do, because being around others can also help foster brain connections, as we'll talk about later. So, watch for that too. You've got a family member, a friend who is always very socially engaged, had a great group of friends, was always quite active, had, something to do most nights of the week or whatnot, or had these regular coffee dates planned, or went to a regular Bible study group, starting to pull away from those things, that could be a sign that they're just not able to engage like they used to and feel comfortable with that. And then number 10, changes in mood and personality. A lot of times we know people and we're as close to them as we are friendship wise or work wise, because we are very familiar with their personality and we get them. As people start to show signs of cognitive impairment, that personality or mood might change. They might be more sullen if they were a happy-go-lucky person. Their personality might change from being very optimistic to very pessimistic. And sometimes those changes might be subtle. So it might not be super obvious, but you might just say, you seem different. So again, these are all signs to look for and to note. They certainly aren't I have 8 of these 10 things going on with myself, or see those in somebody. I have dementia. We can't diagnose somebody with dementia just based off of a little checklist here. So it is important to kind of keep track of these things, but then pursue an actual evaluation to get properly diagnosed and to get proper guidance. Certainly that could be just going to your regular doctor, your family practitioner, but neurologists obviously are very skilled. They're brain doctors skilled in the field of anything cognitive impairment related. An internist certainly has that background, as does a psychiatrist. So there's a lot of options in the medical world to kind of bring your concerns to. A lot of people though do start with their practitioner, and then we'll possibly get that referral out to a neurologist to get further information. So prior to that appointment, if you're noticing some signs and symptoms in yourself or another, please be sure to keep track of all those changes you're noticing, and write them down, because if those impairments are happening for you, it's important to have those written down. Happening for a loved one as well. The more information you can present, the better, because a lot of the types of dementia, the diseases that cause dementia that we'll talk about, are oftentimes diagnosed based off of those symptoms that are reported or observed. So keep track of things in a journal, little notebook. Be prepared to relay that to your doctor, and hopefully you and they will be able to take that time to get deeper into some of those observations you've shared, discuss your current diagnoses, medications you're on with the doctor. There's so many things that can contribute to cognitive impairment that it's just really a big puzzle for you and your medical professional to kind of piece together here. So just have that information on hand and be prepared to share that and ask questions. There's a lot of professionals out in the field. Dementia is one of those conditions that is not going away. We're seeing more of as our population ages. So people are having to become more well-versed in this, our professional medical field. So ask those questions. To kind of figure out what's going on here. When you or your loved one or whoever it is that's being evaluated is seen by a doctor, a lot of times they're going to do a comprehensive review of everything. So in addition to listening to your concerns and your observations and things, they're going to rule out other medical conditions, because there are certain medical conditions that can affect a person's thinking skills or cognition, and they're not necessarily dementia related. If somebody is having there's a whole list of things, and there's probably a longer list, twice as long as this, but a couple of things that could be ruled out that might make somebody look impaired. If somebody is hard of hearing and they have not had a hearing test and not been diagnosed with that, you might have somebody that's hard of hearing asking the same questions over and over again, asking you to repeat yourself, responding to something unusually because they didn't hear it right in the first place. Visual deficits, certainly as we age, things are wearing out, eyes wear out, and there's a whole host of things that can happen visually as our eyes age: glaucoma, macular degeneration, cataracts, just visual changes, nearsightedness, farsightedness, there's need for those lovely bifocals. If somebody hasn't had a vision exam, they could be making mistakes on paying their bills, or getting directions goofed up when they're driving a car because their vision is poorer than it used to be and it's gone unchecked. Other metabolic or vitamin related deficiencies that can be checked for via lab work, blood work. If somebody has issues with their thyroid, that can cause changes in a person's ability to focus and their cognition, their clarity. Also, B vitamins are very important to brain health, particularly vitamin B12. If somebody is deficient in that vitamin B12, that can cause cognitive impairment. I've actually had somebody at one of these presentations share her story about her dad. She's like, my dad was fine. And then all of a sudden he was just not doing well on his own. So she got him to the doctor, took him in, had a full workup, blood work, came back. He was B12 deficient. He went in for regular injections of B12 and she said he was fine. So sometimes it can be as simple as a correction related to something metabolic going on in a person's system. Oxygen deficiency, if your brain isn't getting the oxygen that it needs, it's not getting the nourishment it needs to function fully, just like when we have a cold or whatnot, and that affects our lungs and our breathing and not getting enough oxygen, we feel wiped out and that. So that can also affect our brain. Uncontrolled diabetes, if somebody does not know that they're diabetic and they're having these wild swings in blood sugar, spikes and lows in their blood sugar, that can affect kind of how somebody thinks. When somebody's blood sugar crashes, become more confused, speaking unusually. If it's high, they just don't feel good. They're really anxious. And so if that kind of thing is going unchecked, that could be a problem that could be controlled. Medication, lifestyle changes, that kind of thing. Depression is very similar in that vein, is that sometimes dementia and depression can mimic one another. Folks with dementia are certainly struggling with their day-to-day personal tasks and maybe are not getting out of bed at the right times, caring for themselves because they don't know how anymore. People with depression often struggle with the motivation to do their day-to-day and care for themselves. And depression is a condition that can be managed, we know, by medications, correcting a chemical imbalance in the brain, environmental changes, therapeutic visits with a therapist. So again, is it depression as the person is aging, or is it dementia? So getting to the bottom of that. Medications can have side effects. That's why it's important to bring a list of medications to your physician that you're going to see, especially if you see more than one doctor. Medications can have side effects or can interact with one another that can cause issues with many things, but also, as we're talking about cognitive things, and infection. If somebody has a undetected infection, that can cause quite a bit of confusion. Oftentimes, if somebody has a raging infection, that can become severe and serious, and they can become septic, and that then becomes a blood infection that affects your whole body, including your brain, and that person can be going into a delirium, and that can cause quite a bit of disruption. So it's important to obviously, again, get that blood work and a full evaluation from the doctor to see what's going on. So we do classify dementia into diseases. There's diseases that cause cognitive impairment. We talked about that list of conditions that can cause cognitive changes but can be corrected. What you see on your screen here is, I talked about dementia being a generic term. Dementia is caused, that cognitive impairment is caused by different diseases. Listed are some of the most common conditions of older age that we see causing signs and symptoms of dementia. So I won't go in order of how they're listed, but the most common cause of a dementia is Alzheimer's disease, and most of us are familiar with that being the more common form of dementia. Oftentimes doctors are diagnosing this based off of a person's symptoms, but biologically it's caused by an accumulation of plaques and tangles, which are just different proteins that accumulate in a person's brain that either kind of gum it up or tangle the brain cells up and ultimately strangle those brain cells. I won't get in too deep into the biology of it, but that's essentially what the disease is caused by, is these things that accumulate in the brain that eventually cause brain cell death. And oftentimes it happens in particular areas of the brain in a sequential order. So there's usually a gradual decline and a series of symptoms that doctors will diagnose that based off of. And so oftentimes, the first sign or symptom that's reported is that memory loss. Then you're going to see changes in their ability to communicate, personality changes. Then you're going to see changes in more of the motor skills and things like that. So it's a gradual progression or loss of function. If we think back to that that circle that listed all those cognitive changes, it's a progression of changes that doctors diagnose based off of. Other forms of dementia typically seen in older adults, a stroke. If somebody has had a stroke, that means that there has been a blood clot that's burst in their brain, or there's a disruption in the blood flow and their brain isn't being nourished by the blood vessels, and that part of the brain dies because it's not being nourished, or that blood clot erupts in the brain. So usually when somebody has a stroke and they develop impairments, they're related to the area of the brain that stroke has occurred in. So oftentimes, classic signs of stroke are physical symptoms, physical paralysis on one side of the body or another, changes in the ability to speak, express yourself. Sometimes people may not have those physical symptoms. If the stroke occurs in the frontal part of the brain, they might be more related to personality or emotional type changes. So that form of cognitive impairment related to a stroke, there's specific changes that happen based on the part of the brain where the disruption happened. Couple other forms of dementia that we see regularly in our older adult population: Lewy body dementia, or Lewy body disease. Looks like I haven't talked about Parkinson's. Perhaps I should have first, but Lewy body kind of looks like a combination of Alzheimer's. It's that confusion, that forgetfulness, that impairment in ability to communicate, paired with what looks like Parkinson's disease. It looks cognitive and physical at the same time. A lot of times people with Lewy body fluctuate in their awareness and also fluctuate in their physical ability. They may start to slow down, their muscles might become rigid, they have more incidence of falls because of the muscular component of the impairment in the brain. And again, this is caused by an accumulation of a particular protein in the brain called Lewy bodies. So that affects their cognitive and physical self. And then Parkinson's disease is probably a condition that we don't see as much of as your typical Alzheimer's disease or vascular dementia folks that have had a stroke or even Lewy body. About 1 in 4 people with Parkinson's disease develop dementia related to that. So Parkinson's, for those of you that don't know, is a disease that affects a person's motor skills. It is a condition where somebody's brain stops producing enough of the chemical that regulates our motor skills. So when somebody has Parkinson's disease, they're just not making enough of this chemical, and that causes them to be unsteady, become stiff or rigid, become unbalanced in their gait, have more of a stooped posture. You see tremors. Those are some classic signs of Parkinson's disease. Oftentimes it affects their speech. Their speech becomes quieter because speech is also, we don't think of it as a motor thing, but our vocal cords need to move and have that chemical control of that motor chemical, dopamine, that controls things. So you'll see changes in their voice and whatnot. And you'll also see a slowing down in about 25% of Parkinson's patients in their cognitive skills. They physically slow down, but then they start cognitively slowing down. And so this looks a little different than your typical Alzheimer's dementia, where they understand. It just takes them a lot longer to process information and to respond. So with our Parkinson's folks that we care for, it's really important to give them time to respond to a question, a direction, to do things that they need to do for themselves, because oftentimes they can. It just takes a lot longer. So just those are some diagnoses to be familiar with. There are quite a few other diagnoses that can cause cognitive impairment that your loved one may or may not be diagnosed with in this as they're kind of going through these evaluations for dementia. Like I said, Alzheimer's is probably the biggest piece of the pie there, with probably these days more than 50% of people with cognitive impairment being diagnosed with Alzheimer's. Parkinson's is, just like I said, a smaller part of that puzzle, that pie, because not everybody with Parkinson's does develop cognitive impairment. Lewy body, we're seeing that diagnosed more and more, and vascular dementia is certainly a condition that we see a lot of, being that many people have issues with their blood pressure and are at higher risk for stroke. So we do see a fair amount of folks being diagnosed with that. These next few slides that we're just going to show up on the screen are a good reminder, I feel like, when I'm speaking and educating people, that dementia, or in this case, these pictures label it Alzheimer's, is a physical condition. There's a physical change that occurs in the body, but we can't always see it. We can't see those changes in the brain because they're behind our skull. Physical changes related to if somebody has broken a bone or whatnot, you can see that they are impaired because they have their arm in a sling, or they've broken their leg and they're using crutches. So they're going to need help. With our folks, with people with dementia, with individuals with dementia, we don't always know physically what's going on, but there's a lot. You can see from this photo here, there's two images of an actual brain. The one on the left side there is somebody that has passed away, and they had no signs and symptoms of dementia. That is a healthy brain. The brain on the right-hand side is a person that has passed away from Alzheimer's disease. So that is a brain that has gone through a lot of change over the many years that person had the disease since diagnosis. So you can see in that image that brain is much smaller than the normal non-Alzheimer's brain, and that just indicates that brain cell loss. And with the loss of brain cells, tissues, the brain becomes shrunken, and the brain does not do what it should be doing, because those brain cells are lost that control those different things that our brain does for us, those thinking skills, thinking back to that circle of all of those things that our brain manages. So you can see that there would be impairment if that part of the brain does not exist. So the next couple slides here are just specific areas of the brain. This slide here is cross-section of one of the parts of the brain that helps us manage our communication skills. When the top brain is normal, the bottom brain is somebody that's passed away of Alzheimer's disease. When we see in folks with dementia that they are not able to express themselves or understand, this is why that part of the brain is highly deteriorated. So they're not going to be able to find the words because their brain just isn't making those connections anymore. The next cross section that we'll look at is the memory portion of the brain. On the top is a healthy brain. On the bottom is somebody that's impaired, has passed away of Alzheimer's disease. And so this, again, I would think emphasizes why people with dementia, with Alzheimer's disease, cannot remember things, because that part of the brain that helps kind of connect and form and pull out those memories has deteriorated. There's a hole there. So again, I always say, especially when I'm training new employees, look at this picture. When you see a resident that is that has forgotten to take their walker with them when they're walking. Don't say to that person, Mary, you forgot your walker, because of course Mary forgot her walker. She's cognitively impaired. Her memory is impaired. That part of her brain no longer works. So instead of, Mary, you forgot your walker, because you're stating the obvious, Mary, here's your walker. Let's go. Instead of pointing out something that is problematic. So all that being said, we saw all of those images, those last 3 images of the brain that's been affected by dementia. That doesn't happen overnight. A person with dementia doesn't just become impaired and lose all of their skills at one time. This usually happens over the course of years. So we cannot really lump people together into that category of just they have dementia, because there's so much that changes in dementia. And so one of the ways that dementia is oftentimes looked at is in stages. So I've mentioned a couple times, in that early stage when they're starting to show signs of dementia. So we talk about dementia and the progression, and how we as family members or people helping folks get through this journey, we talk about the stages as the early, middle, and late stage. Early stage, being lesser problems, middle stage and late stage being bigger problems. And so it is really important to spread out the course of dementia, looking at it in these stages. However, what we do try to do here, especially at Emerald Crest, and your medical professionals will also probably be doing this as well, is honing in a little bit more closely on the stages of dementia. It just helps us to become a little bit more well-versed in the changes that are occurring, and what to do and what to look for kind of in the future. So Christine, if you want to just pop forward to the next slide after this one. So once somebody's been diagnosed with dementia, that you're on that path. That they're probably in one of 3 stages at this point. It is important to seek out further resources to support you as the care partner, your family, that person, yourself, by seeking out, organizations that specialize in dementia care. Top of the list would be the Alzheimer's Association. Plenty of online resources. They have online support that's available 24 hours a day. Support groups are offered through all sorts of healthcare organizations, churches, things like that. That is also very supportive as you're going through this journey, so that you know that you're not alone, that other people are experiencing the same things, and that the abnormal things that are happening are actually normal, and those support groups are crucial, I feel, for families that are going down this path. Adult day programs can be a huge support if your loved one is still living at home, you're still working or whatnot. If you are that care partner, adult day programs can be a huge resource for supporting a person with dementia. Those day programs are designed to engage people at that cognitive level that they're at. There's activity throughout the day, different programs there. It's a place you bring people to. You can certainly use companion aids as a resource, especially if your loved one has dementia and is still living at home, getting extra support that way. So if you do still work, or if you need to just leave the house and run an errand and aren't able to do so with the person with dementia, there's just ways you can utilize those companion aids. Home care can come in to do evaluations of your home if your goal is to keep that person living with you and thriving in their own home for as long as possible. Resources there. And then certainly memory care facilities. If you're planning for the future, many memory care facilities are open for tours and providing that information and resource, even if you're not looking for in the immediate. It's still nice to kind of get your feet wet and learn about what's out there. At Emerald Crest, I will speak specifically for us. We have had families that have inquired about memory care, not because they need it now, but because they feel they may in the future. And one of the things we offer is to do an assessment, a cognitive assessment, a medical assessment. Our nurse and our OT, myself, would go out and kind of just give you a baseline of where things are at right now and maybe make some recommendations. So all of those resources listed can be supports in kind of getting moving in this dementia journey that you're embarking on. So for the remainder of the presentation here, we're going to go even deeper into the changes that happen over the course of dementia. Mentioned early, middle, and late stage. Well, we're going to go a little bit further into the scale that that we use at Emerald Crest. A lot of other communities use this as well, especially in rehab. If somebody's in transitional care, a lot of times the therapists that are evaluating them there are making recommendations based off of this leveling system. So we'll talk about those. Allen cognitive levels is the system that we use. It's an occupational therapy based theory that looks at a person's cognition. It's a 6-point scale, and it helps us to guide our recommendations based on where a person scores within this scale. Somebody that's scoring at a level 6 is independent. They are fine. They are able to care for themselves. That would be you or I, those of us kind of engaged and involved in this presentation that are living on our own and working and managing our lives without really any in-depth support from another. So 6.0, we say, is the highest level. 1 is our lowest level. So as somebody goes through changes related to their dementia, we can put them on this scale based on observations, based on testing that we can do. And the lower the number gets, the more impaired they become. So you can see kind of the gradient on the bottom here. 6 is somebody that's independent. As somebody is moving into the level 5s, that's what we would more consider that early stage dementia when we were just talking about those stages. More of the early signs and changes happen in the level 5s. As somebody moves from level 5 into 4, they're becoming more impaired and needing more supervision and assistance. And then as they move through those stages into levels 2 and 1, we consider that more of the later to end stage of dementia where a person becomes severely impaired. And so I'm going to go into detail coming up here on all 6 of those levels. So diving into cognitive level 6, that means if you're scoring level 6 on this cognitive testing that we do, you are fine. You are independent in what we call instrumental activities of daily living, which is things like preparing meals, driving a vehicle, managing your finances, and things like that. You're caring for yourselves, your cognitive skills are intact, you're able to make decisions, you're able to learn new things, and whatnot. So you have no issues. We're able to, at a cognitive level 6, learn new information, and kind of just move gracefully through our lives. So what we can talk about at level 6 here is what we can do as healthy individuals that are not showing signs of dementia to maintain our brain. So there's several areas that we can focus on to help maintain our brain. Certainly your diet, the things that you consume are going to either nourish or harm your brain. So it's really important to eat a healthy diet, especially foods higher in antioxidants. Those are elements that we get from the foods that we eat that help eliminate some of the bad molecules in our brain that can cause oxidation, which is kind of a fancy term for, I like to use the analogy of kind of rusting away at your brain cells. It prevents that rusting from happening. So eating a diet high in antioxidants, lots of dark green vegetables, darker colored fruits. They recommend eating the rainbow, avoiding those things we know we should, fatty foods, greasy foods, trans fats, saturated fats, keeping our diet lower in those things is going to help. But good fats, there's fats such as omega-3s that are brain protective. Our brain does need those for signals to be sent from brain cell to brain cell. So there's good fats and bad fats. So avoid the bad ones. Eating foods rich in folic acid, that's a mineral that's important to our brain health, especially development as well. When big children are developing, making sure that they get a lot of folic acid, but certainly continuing that, eating a lot of healthy foods and juices, limit alcohol, drink lots of water, kind of limit the fruit juices because of sugar, but they also do have antioxidant properties in some of those, and then limiting caffeine. So just kind of being mindful of what you eat, because what you eat makes you feel good or bad, and also affects how those brain cells are nourished. So eating a healthy diet is really important to maintaining your brain. Kind of moving along here, staying active is super important to maintaining brain health. Getting plenty of exercise, like I said earlier, what is good for your body is good for your brain. So getting plenty of exercise, that's going to obviously kind of keep your blood flowing, keep the oxygen flowing. Your brain needs all that circulation. Stay active by learning new skills. I think the older we get, the kind of more set in our ways we get, or this is just how we do things. But certainly pick up a new hobby, or take a class on something. Just be open to learning new things. Even things like using your non-dominant hand to do things. Like if you're a righty, use your left hand to put the dishes away. Or I'm not suggesting you write your checks out with your left hand if you're a righty, because that's probably going to get a little messy. But certainly using your non-dominant hand side of your body, that can continue to make brain connections even as we age. Driving different routes, I don't know about you, but I drive the same way to work every day. But you know what, if you change the direction that you go and you maybe take a different route or take side streets instead of the highway, that's going to make you think a little bit differently. And don't cheat, don't use your GPS. Try to use your brain to navigate your way through things, because that does help foster new connections even in an old brain. So keep active. Also maintain your relationships. One of those possible warning signs of dementia was somebody pulling away or withdrawing from social interactions. Keep that up. Your friends and your family are your best support. Keep social, keep doing things. Don't get into that rut of just doing the same thing over and over again, or just saying, oh, I'm a homebody, I'm going to stay home. Get out and do things. Join groups that are of interest to you. Have things scheduled regularly. Maybe Thursday nights are the night you get together with your friends and you just kind of sit around and chat, but it's your time together. So schedule those things. Those things are good for you. Those relationships are so very important. Outside of keeping busy and active is also the most important one here. I feel the last thing we'll share about maintaining your brain is on our next slide here, is about getting enough rest and relaxing, kind of pulling back. Life is stressful. These last couple years for many of us have been the most stressful yet. So, and one of the things that a lot of the experts out there are saying is that stressful living can contribute to a decline in brain and cognitive function. When we're stressed, our body produces a chemical called cortisol, and cortisol has been shown to be very destructive to your brain. So by taking a step back, making sure you're getting plenty of sleep, that's going to limit the amount of cortisol your brain produces and kind of replenishes your brain with the good stuff. Slow down, like I mentioned before, with the keeping busy, finding a hobby. Some people like to meditate, journal, just take some time to yourself, where things are just quiet. You're not being interrupted by other things that you find relaxing. Listening to music, going for a walk in nature, all of those things can help you kind of just your brain kind of just settle a little bit, because settling is important too. So a lot of things that we can do if we are not showing signs of dementia to kind of maintain our healthy brain. If somebody is showing signs of impairment, if that is you, and you're listening, you're showing those signs of mild cognitive impairment, or things that we've talked about earlier, just kind of a disruption in your thinking skills, we're going to move into that Allen cognitive level 5, which is oftentimes you'll hear the term mild cognitive impairment, or we correlate that with earlier stage dementia. At a level 5, we're just moving off of being independent at a level 6. Oftentimes folks in the early stage of dementia still are doing fine with the basics, the things that we are all in a routine to do. Independent in our daily cares, taking care of ourselves, getting dressed and things like that, taking a shower, certainly not needing help with those things, still able to do those things because we've been doing them our whole lives. And so at a level 5, cognitive impairment isn't affecting our day-to-day personal care. We're noticing, though, problems in a person's memory. They're maybe not remembering as much, keeping up with as much in conversation. Maybe pulling back from doing the finances, especially if it's a spouse situation where one person always did the finances, somebody else might need to kind of take that over, or they might start to do finances together, or one spouse may have to take over the driving from somebody if they're having trouble kind of navigating that, or driving out on their own anymore. Issues are probably also going to be seen with how a person kind of organizes their day and their life. They might be a little less guided in some of those like day-to-day things that they used to do. But there's a lot of positives in this early stage of dementia. People are still aware and alert and engaging, able to engage with their family and things, can still learn new things, just takes a little bit more time. And so I had mentioned earlier that oftentimes that those early signs of dementia in the early stage are noticeable maybe at work or in things that require a little bit more attention. So, it might take them longer to learn new tasks at work, but if that's a reasonable accommodation that somebody's workplace can make, then that's great. So, just things to look for there, those earlier stage changes. If somebody is diagnosed with dementia and they are in this early stage, there's a lot that can be supportive and helpful at this point in their condition. There's a lot of resources out there in the community. I mentioned earlier adult day programs. At a level 5, people might not need that, but they may get more involved in the community center. A lot of community centers have senior programs where they're social and there's outings, and it's just a little bit more organized activity throughout the day versus somebody that's maybe at home still by themselves or with their spouse, but pulling back from doing those things. At a level 5, there's the ability to, with your loved one, if they're showing these signs, plan for the future, can still make decisions about their healthcare directives, preparing their will and things like that. It looks like see, I'm just kind of reading through my list here. Looks like there's other things that I've already mentioned here that can kind of be supportive. Helping that person manage those things that they're forgetting, like maybe they're forgetting to take their medications, or they're forgetting important appointments or dates or things. So keeping track of those things on calendars, making more lists, setting up medications for somebody at this early stage versus having all the pill bottles on the counter. Just a lot of interventions that can kind of help that person cope. I always say that at cognitive level 5 in the early stage of dementia, we can use a lot of coping strategies, either the person themselves, or we can help them find coping strategies like writing more things down, like keeping medications divvied up into a med box, modifying the environment so that it's safer, and then just kind of giving that person a little extra time to do what they need to do, but let them do as much as they can for as long as they can. I'm going to say that a lot here moving forward. We want folks at every stage of dementia to do as much as they can for as long as they can. That's just only going to help them be a more active part of their own personal care, and be more comfortable with our support. Moving into cognitive level 4. So at early stage dementia, still doing okay out in the community, especially if they have the support of a loved one that they live with or somebody checking on them regularly. At a level 4, this is where we're getting more into this middle stage of dementia. Things get a little bit more fuzzy. A person might look okay, but you're going to start noticing some subtle changes. Maybe they're looking a little more disheveled. They're not keeping up with their personal care as well. They're not changing their clothing as regularly. You might notice a weight loss in a person if they're living alone, especially at this level 4. This is where we notice more of those challenges with communication. They oftentimes will sound okay initially, but they'll start repeating themselves, repeating questions and stories. So those are some things to watch for. Typically at this level, they still can do things. They're just not remembering what cares to do. So that's why we see some of that disheveledness, maybe wearing dirty clothes over and over again. By the end of this stage or level, I should say level 4, people are definitely needing a lot more supervision. So somebody at a cognitive level 4 is likely not going to be able to live alone for much longer at this point. So if your loved one is at a cognitive level 4, there's quite a few resources available still here. If they're still living in their own home, in the community, there's certainly community resources. This is where certainly that adult day program becomes likely crucial if they're still living with a care partner at home. It gives that care partner an opportunity to get a break, because care and engagement and mood at home might be getting a little stressful. So using those community resources through the adult day programs, through community programs, can be really helpful. You as a care partner of this person at a Allen cognitive level 4, you're going to need to monitor to make sure that they are changing their clothing regularly, and they're getting their daily personal cares done, as far as somebody initiating that. And that might just be laying out clothing and giving a verbal reminder to get dressed. Telling them to take their medications, be that a phone call or stopping by and making sure they do that, making sure that they are eating their meals, setting up things to help them to, oh, this is what I have to do right now, realize those things, because they still are able to, they just need a little bit of that extra support. I use that word a lot, just a lot more support at a level 4, verbal, visual guidance and support. Other ways you can make home more safe, modify the environment, make it easy for them to get around, make sure that there's no trip hazards. If you've got a lot of stuff in the house, if they've got a lot of stuff in the house, maybe downsize that so it's not as overwhelming. They don't have as much to navigate in the house. Sometimes care wise, getting in and out of shower can start becoming a little unsafe for people. So you might want to put a bench in the shower so they can sit down in the shower. So just a lot of ways that you can modify, where a person's at that level 4, if they're still living at home with a care partner. But kind of at this level 4 is where we're going to start to see families maybe needing to make that decision to have somebody come in and help with care, or they're going to start looking for a care center, a memory care unit to assist kind of on a 24-hour full-time basis. So level 4 is kind of that transition. It's like if you've got enough support out in your own home, then you're good, but might need more help. So 4 is transitional, may or may not need to be placed, but 3 is where somebody is needing that full supervision and full assistance with all of their personal care, with all of their thinking skills, what you see, what are characteristics of people in this later part of the middle stage at an Allen cognitive level 3. This person is going to be more restless. These are your folks that are, where do I go? What do I do. There's more anxiety. If they are still living with you as a care partner at home, there's probably going to be more sleepless nights. Days, unless they're structured, are going to be a lot more restless for that person. They're probably going to be rummaging or wandering throughout the house, trying to keep themselves busy, maybe trying to leave the house, needing to go somewhere. They start to have this sense, if they're still in their own home, that that is not their home, that they do need to go home. So if some of you are still caring for your loved one at home and they are possibly at this cognitive level 3, those are some things you might see. When they speak, it doesn't always make sense. So you're going to have to learn to be more of an interpreter at this point. And so just a lot more hands-on assistance and definitely full-time supervision and assistance at this level. So as far as our recommendations for somebody at this level is that they will need 24-hour care, somebody living in the home or going to a community, a facility where there is that 24-hour care and supervision available. It is important at this cognitive level 3 to really partner with the person to make sure those care needs are met. You know, somebody at a level 3 still is able to brush their teeth, comb their hair, put their shirt on, put their shoes on, but they do need direction to do that. They need step-by-step direction to do that. And these folks also, if you are trying to do too much for them, they will resist. They'll get upset with you for doing it for them. They can still participate. So offer that opportunity. So look at yourself as a caregiver as just that person that's kind of filling in the gaps for what they no longer can remember to do, but encourage those things that they still can do, those abilities. We definitely want to focus on the abilities still here as a person's moving through their course of dementia here, middle stage. The next slide will just show some recommendations that we often will make for that person to help them focus on their meal. That's the first line of images here. As people are moving into this Allen cognitive level 3, this more into this middle stage of dementia, they're getting overwhelmed by too much stuff. So one of the areas that we notice people getting quite overwhelmed with is mealtime. And so you might see somebody at a level 3 not eating. They stop eating. Maybe it's because there's too much food on their plate or there's too much distraction at mealtime. You can see in the picture on the left-hand side, that looks like a pretty normal mealtime setup for us, like we would see, in our own homes or at a restaurant or whatever. But for somebody in this level 3, that's going to be too overwhelming. What do I do with all this stuff is probably what's going through their head. So we tend to simplify. Simplification is the name of the game at a cognitive level 3. So instead of having all those utensils out, just put out the one they need. Put out one glass of beverage for them to drink. They might need some verbal cues to get started eating. So just some ways, that's just a visual way of simplifying a meal for somebody. Especially if they're more in that middle stage of dementia, and you notice they're not eating like they used to. They're needing more cues and more support. The middle series there is how we can, as care partners, simplify how we're communicating with somebody with dementia at this stage. They're maybe not going to be able to understand or follow conversation with full sentences or multi-step directions. So we're going to have to break things down more simply, give step-by-step directions. That might take the form of one-word directions or visual demonstrations. For the folks that we care for at this cognitive level, I do a lot of demonstrating and charades when I'm helping care for them. I'm mimicking, comb your hair. I've got a fake comb in my hand and I pretend to comb my hair. I pretend to put deodorant on. I show them what I want them to do, and that usually helps kind of pair your words up with what you want them to do. You may need to, in addition to verbally and visually cueing, you might need to physically cue that person. And then on the bottom there's so many ways to simplify activities. Think about your loved one and what are the things that they enjoy doing. This is an example of puzzles. If somebody enjoys doing jigsaw puzzles. They may have been able to do a many 100-piece puzzle at one time. As they're going through the stages of their dementia, they can still do puzzles, just might need to get fewer pieces, bigger pieces. You might need to help kind of position or do the puzzle with them to kind of help them get started. And then as they decline further, there's ways that we can get similar puzzles that have an outline that you just put the shape into and that kind of thing. So ways that we can kind of alter and simplify activities as well. So meals, communication activities, we can simplify it all. We also want to think about if your loved one with dementia is still living in the home with you, simplify the amount of things you have around the house on the countertops. I'll give the example of bathrooms. Bathrooms can get pretty cluttered with all the products that we use to care for ourselves. And so this image here, the one on the left here, shows a bathroom countertop that's got a little bit of everything on there. There's some shampoo, hairspray, some hand soap, a couple cups, some lotion. And a lot of times what I'll say is all of this stuff, because a person at a cognitive level 3 in this middle stage of dementia, their ability to recognize things has become quite poor. Reading is definitely a challenge, and so they are probably not reading things. They are just looking and they're seeing, oh, there's some liquids here, I'm going to pour myself a cup of something to drink. They could very easily pour themselves a cup of that hairspray or that liquid soap there that we see. So we do recommend simplifying your spaces so that supplies are not out if they're not needing to be used. As the care partner, put those things away and only bring them out when the person is needing to use them, and you are there to guide them to use those items. So that's just one area that you can simplify the space that they are in. And then our final recommendation here in that middle stage of dementia is, like I said, these folks are your folks that are, where do I go? What do I do? And so when somebody has no idea how to structure their day, we as the care partner need to structure their day for them. And so a schedule is highly, highly recommended. A routine, get them into a routine, get yourself into a routine. This is an example of the schedule that we provide for our residents at Emerald Crest to make sure that they know what's happening next. So there's not that getting up from the dining room table, where do I go? What do I do? We gently guide them from one thing to the next. So have your routine set if they're still living at home with you. This makes all the difference. We at Emerald Crest, we try to incorporate a variety of activities into a person's day. As far as active things, exercise related things, music related, things like that a lot of people would have an interest in. We play games that they would be able to engage in at that level. We create crafts out of snacks. We have a Bible story group that we do. We do our activities day, afternoon, and evening to kind of keep that day moving for folks at this level. It is so very important. And then we kind of wind our day down. Throughout our day too, though, and I will mention this to those of you that have a loved one at home throughout your day too, busy is important, keeping a routine is important, but also that rest is super important. So you'll see kind of before our meal times is when we at Emerald Crest will try to incorporate some of that rest. We keep folks busy and then we acknowledge that they're going to need a little bit of a break. So that balance of activity and rest is going to be a really, really important intervention at this middle stage of dementia. If they are still living at home with you, but at a facility, that's oftentimes the goal, is to keep people busy. As people move out of a cognitive level 3 middle stage dementia into a cognitive level 2, if they're scoring at this level when I do testing, we consider them to be in the late stage of dementia. At this point, there's little to no engagement in their care. We are doing that for them. They are dependent, but they can assist in little ways. Let them hold on to a wash rag and wash what they can while you're doing the rest of the washing of their body. just things like that, letting them hold on to things. If you get a shirt started for a person, let them pull it down the rest of the way and adjust it. Or if you get their socks started, let them pull it up the rest of the way. So little ways that you can encourage people in the late stage to engage. It's not going to work forever, but I always say try it, because that's always a very helpful thing to do, to kind of get that agreement and participation in things. Because at a level 2, people start getting more fearful because they don't understand what you're saying, what you're doing to them. So just be very clear, slow in your providing of cares, and gentle. Our goal here with folks at a cognitive level 2 is to, provide comfort in the care that we do provide and the activity that we do provide. You're going to see a significant change in a lot of things in this area cognitively, just not recognizing people, things, objects. They're going to pick things up and maybe put them in their mouth, or use the fork incorrectly, use the fork to comb their hair at the table, use the toothbrush to brush their hair, put things in their mouth that are not actual food. So it's important at a level 2 just to be mindful of what's in the vicinity of that person, because they might not recognize that object, might not recognize familiar people. I think this is probably when I'm talking with families, the hardest part that one might encounter is when they stop recognizing you as a very close loved one, as a spouse, as a daughter, as somebody that's been very significant in their life. And that can be really hard. They also maybe are not recognizing themselves. We see this a lot, where they don't recognize their own image in a mirror anymore. And so some of those losses can certainly be very hard to kind of grapple with. But just this presentation really is just kind of a broad overview of what to expect, what to prepare yourself for. It's never easy. I always acknowledge that even though we know what might be coming, that doesn't mean it's going to be easy. So just know at this late stage of dementia, a person is quite disconnected, but also still highly depends on people that are important to them and bring comfort to them. So all is not lost at a cognitive level 2. What can we do for our folks at this late stage of dementia to bring them kind of comfort and calm? We utilize a lot of sensory interventions. So that's things like music, things that they can hear that are calming to them. So try to learn what people's favorite types of music are. Hand massages, back rubs, foot rubs, those are all things that a lot of times I will recommend to families. Well, I come visit and, well, they can't have a conversation with me anymore. And I feel like when I say things, they just don't follow along. Sit with them and just hold their hand, give them a hand rub their back. Our residents find so much comfort in that. I know when I'm in the houses with the residents, if I sit down next to somebody, I will just rub their back. Oh, and they usually say that feels so good. So we forget that sense of touch can be really really important and really comforting to people. The bottom image there is aromatherapy. I talked about using the senses, music for sound and touch, but aromatherapy, there's certain fragrances that can trigger memories, or that can calm people, or that can alert people. In this photo here, we use lavender. That can be a really calming fragrance if we diffuse that. Peppermint can be an alerting fragrance, as can citrus fragrances. At Emerald Crest, we cook all of our food in the kitchens of our houses, and so the residents can smell that. So a lot of times that brings a sense of comfort, because they smell a familiar smell, and things like that. So all about comfort here in this late stage of dementia, as somebody kind of moves into this late stage. And then from level 2, level 1 is considered more of that end stage of dementia. This is where residents are very much disconnected. They probably spend a lot of time with their eyes closed, maybe spending more time in bed, sitting up in a chair less, maybe up for meals, but then laying back down because their body and their brain is just slowing their body down. And so they do need more rest. They're totally dependent in all their care, and just spend a lot more time kind of inward, with their eyes closed, relaxing. So at a level 1, at this end stage of dementia, a lot of times we are at a point of recommending more supportive care services such as hospice or comfort care, to not only bring the resident the support they need, but also the family. This is the kind of the end of that journey that you've been on for some people many years. So kind of at that end stage of dementia, to wrap up here, just bringing on all of those extra services and supports, because this is certainly a journey that takes a village. We all need that support. And so at Emerald Crest, we offer that to our families, but there are services out in the community. Reach out to your friends and your families and your congregations to get the support that you need. So that's kind of where we're going to wrap up with the Allen cognitive levels. We've made it to that end stage of dementia. And so kind of backing up then, where to start if this resonated with you in some way related to what you're going through, or a loved one or a friend is possibly going through. Starting off, just getting educated, seeking that evaluation. Like I'd mentioned, don't just use that 10-step checklist to say, oh gosh, okay, so this person has dementia. Seek evaluation, get support from others, be that a support group, your family, your friends. Utilize those community resources that are out there. Christine, who's hosting today, and Elizabeth, and our sites, we all have can all offer opportunities for you to get an assessment or give you ideas for resources that you can utilize out there. And then for all of us that are kind of listening in here and doing our thing still and are trying to maintain an active lifestyle, follow all those tips to maintain your healthy brain so that you can be the best you can be. So yeah, I appreciate everybody's attention here. I did go a little longer than we had intended, but there's a lot to share. So like Christine said, if you've got questions, share those in the chat section. But otherwise, we're all available by phone, by email, and Christine would probably be happy to share that information.
Yes, thank you, Sarah. Great information. So yeah, let's take a minute or two. If you have any questions specifically to Sarah, you can put them in the chat. If you'd rather ask by unmuting yourself, just note that in the chat as well, and we'll go ahead and unmute you, and you can ask those questions. While we're waiting to see if we have any questions, I just want to bring up our next session. Part 2 is next Wednesday, November 9th, 10 a.m. And it's on dementia and adult day services. We're just going to focus on, what is adult day, how it can be a resource, a respite for those caring for someone with dementia. Adult day is something that not many know about, but it can be a huge resource and benefit for those that are starting in that early to mid stage dementia. So good information we'll have next week. You can sign up if you haven't already by going on to emeraldcrest.com/Zoom3. You can sign up for those. We'll send you a link just like we did with this one. For those that are healthcare professionals, I know that you like to get continuing education hours. So if that is something you need, go ahead and put your name in, or your name and email in the chat, and I will make sure you get your CEU as well. Probably within the next few days. If you can give me some time to get that out to you, I will make sure you get that. And then we will have handouts and recording of this presentation available on our website as well, probably within a week too. So look for those. I'll send an email out to the whole group here. So, all right, let me look in to my chat here. It doesn't look like I have any questions, but I'll read through real quick. No questions at this time. If you do have a specific question you want to ask more individually to myself or Sarah, you can go ahead and email me and I will direct it to Sarah as well, and we can correspond via email. But for now, I'll just wait and to get all these individuals who need CEUs, and we can end our presentation. And thank you again for all coming, and hopefully see you next week. Thanks so much. Thanks, Sarah.
Yep, thank you. Take care.